Hello, and welcome to my expert interview presentation. I interviewed Erin Kunst, Program Specialist for the Live Well at Work initiative, which is funded by the County of San Diego through the Live Well program and run by the University of California, San Diego Center for Community Health. The mission of the Live Well at Work program is to help businesses to improve employee health and prevent chronic disease through education, engagement, and environmental changes. As incentive for the business, achieving this mission will improve recruitment and retention of healthy employees, reduce healthcare costs, increase productivity, and decrease worksite injuries and sick days. The program goal that supports this mission is to create work environments that support healthy eating and physical activity for all employees. Per Mr. Kunst, the program focuses on policy, system, and environmental interventions, abbreviated as PSE, in order to achieve its goals. By changing the policies, systems, and environments that affect how employees eat and move at work, a business can make the healthy choice the easy or perhaps even the only choice. Further, these types of interventions tend to be more sustainable, and once they are put into place, they tend to remain regardless of employee turnover. Now let's discuss some of the specific types of interventions that the Live Well at Work program uses to achieve its goals and objectives. A common policy intervention is to have companies adopt a Meet Well policy that requires meetings to support healthful habits. This may be committing to serving water instead of sugar-sweetened beverages, always having a vegetarian option when food is served, or even making environmentally friendly digital presentations. The Meet Well Pledge is handed out to employees who sign and display the pledge in their workspace. An important system intervention is to modify select job descriptions to include wellness responsibilities. Putting these into a person's actual job description creates accountability for taking action and ensures that wellness activities will not be lost due to employee turnover. One of the program's most popular interventions is a good example of an environmental intervention. It is to set up walking routes in and around the office. Routes of varying distances are established, communicated, and marketed to employees. Employees are encouraged to have walking meetings, or to walk at lunch, or to even take a 10-minute quick walking break during the day. Signage is set up to clarify routes, and routes are created in distances ranging from a quarter mile to several miles. The program is funded through a SNAP-Ed grant, which is managed by the County of San Diego. The funding requires that a certain number of new businesses are recruited each year, that a certain number of interventions are performed each year, that participating businesses do not exceed a set average wage threshold, which ensures that the program is servicing low-income populations, and that participating businesses have at least 25 employees so as to maximize the program's exposure. The program typically works with the business for 2 to 3 years, after which time the support is given more so around maintenance of the program rather than establishing new interventions. As with most nonprofits, resources are tight, and this program does a lot with what little it has. The program currently has 4 full-time employees and also utilizes volunteer interns. The program depends largely on its network of partners within the San Diego community to connect them with eligible and interested businesses. Once they are connected with the business, it is important that the business itself takes ownership of marketing the program to its employees and supporting the culture change around the interventions. This type of support is outside the scope of support from the Live Well at Work program, but is integral to success of the interventions. Evaluation for the program is largely qualitative, consisting of success stories and feedback from businesses and employees. Other evaluation metrics include the number of businesses worked with each year and the number of interventions completed. Although that is all that is required by its funders, the program has additionally created an employee health behavior survey to analyze the effect of its interventions on health behaviors, but they have had challenges in collecting reliable data. As with many community health programs, the Live Well at Work program does a lot with what it has. By focusing on PSE interventions, the program is able to improve the health environment in the workplace, thus making healthy eating and physical activity behaviors the easy choice for employees. Given more resources, the program may be able to conduct more quantitative evaluations, thus providing better feedback on success factors for its own program community.